Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I have with me in the studio today Dr. Chima Asonye.
Thank you, sir. It's great to be here.
You're
Father.
welcome. Welcome to the studio. This is Terra, and at Reflections, we discuss a number of issues that will help human development, promote values, and for the society, for the individual. And then we do a lot of work at Terra on mental health. We have a psycho-spiritual institute that I told you about.
Yes,
and then we run regular psycho-trauma healing skills training courses. And then I met you, and you are founder of Nigerian Mental Health.
Yes, sir.
And I said, wow, so I'm meeting Nigerian mental health. But also, that also implies Nigerian mental ill health.
Yes, and that's one way of thinking about it.
Yeah.
That's one way of thinking
because
about it.
Because it's a spectrum, isn't it?
It's a spectrum, and I think that the key thing is that when we think about mental health, it is not something that just affects those who have a mental health condition,
yes,
right? But health is something that everybody needs to be thinking about.
Yeah, so what I mean is that, so when you're talking about Nigerian mental health,
it implies everyone.
It involves Nigerian mental ill health.
Yes.
Nigerian mental well-being.
Yes.
Involves Nigerian mental ill-being.
Yes.
So Chima is the founder of Nigerian Mental Health. He's a lawyer.
Yes, sir.
But is passionate about mental health of Nigerians. And he founded Nigerian Mental Health. And among the other activities, he is in the forefront of promoting the translating into law the mental health bill that is in the National Assembly.
Yes.
And a lot of progress has been made, but we are still awaiting the president's
assent right now. Yes, it's actually not with the National Assembly right now. It just left November 28th. So we're on the precipice of it going to the president, and we want the president to sign President Buhari. It's historic. We've never had transformative mental health legislation in the history of our country since independence, as a matter of fact. What we have now is a regional lunacy act that was actually established in Lagos pre-independence, that is devoid a lot of human rights.
That's Lunacy Act now.
Yes,
That's the one that says that if somebody is what we call mental health today, should be locked up in some asylum.
They should be locked up and chained, and that's what we see going on today, right? It's called the Lunacy Act, and it actually gives rise to what we think about mental health. 1958. But it actually dates back before that. Its roots are 1916. 1916, it was an ordinance, and it was codified a law in 1958. So it has British colonial roots. So right now,
what was it called? What was the Lunacy Act? What was it called that time?
It was actually called it was called the Lunacy Ordinance. And then it was codified as the Lunacy Act in 1958 as a law. And the unfortunate thing about it is that we have become the Fourth Republic. We're a whole new democratic dispensation, and yet no National Assembly member or elected member of this parliament, of this legislature, has actually passed mental health reform. So that means that Nigerians, in one sense, if the National Assembly is the voice of the people, then we've never had the voice of the people regulate, legislate, and make sure that there's codified human rights of those with mental health conditions. And we're saying that we're going to change that.
What it means, I mean, we have experience here because we have been working in this area for quite some years.
Yes.
What it means is that to the highest level in this country, mental health is not appreciated.
At all.
At all. So people talk about communicable diseases, non-communicable diseases. Look at when COVID came, everything was mobilized to see what we can do about it. And yet, there is an epidemic of mental ill health in our society.
Yes.
I don't know if you read my paper, my recent paper.
And it was one of the good points in there. And I think that you said it exactly. There is not a priority. Let's think about what the law is. Law is the ultimate expression or social contract of the government with its people, right? And that it codifies it in law and then builds apparatuses, enforcement mechanisms to support that. And we don't have that when it comes to mental health. And if you look at every single barometer, you can see that mental health is not a priority. When it comes to the budget, First, we're not prioritizing the health budget. You know, if we look at the Abuja Declaration, all African governments are supposed to have 15% for health.
We have less than 7.
We have less than 5. You know, actually, well, in this recent budget is less than 6%, but you're right, less than 7%. And at least it's a small smidgen above 4% that we had the last budget cycle. But that, even if that 4 or 5%, it's minuscule as it relates to mental health. Some of the figures of past budgets have said the mental health budget as it relates to the entire budget is 3 to 4%. But when we actually look at mental health, we have to link it with health and disability and persons with disabilities. More hours are spent with folks who have mental health conditions than any other disorder out there. So we can't be talking about health without talking about mental health. It's actually the first Director General of the World Health Organization that said that there is no true physical health without mental health. So we have to be making those links. And it's a time for the president and all of us to get together to ask President Buhari to sign this piece of legislation. And the great thing, I think, is that President Buhari, people can know him for a lot of reasons, but he's a big champion, really, of the disability community. The last election cycle, 2019, right before the election, he passed the Rights for Persons with Act Against Persons with Disability Act, right? That was passed January 23rd, 2019, right? He's also established a national commission for persons with disabilities. So if he wants to double down in his prowess when it comes to those who are vulnerable, those who are persons with disabilities, he has to pass to the National Mental Health Bill. And we have 90 days. So it is, yes, it's the end of February, but we're hoping that if any lessons learned from what he did with the Past Disabilities Act, where he signed in January, we're hoping that in January, he will also sign this.
Now, I know that
leading
the
up to the
Nigerian
elections.
Psychological Association are also putting a lot of pressure on this, trying to use all kinds of influences and mechanisms to reach. Now, and your organization, Nigerian Mental Health, you are
collaborating.
You're collaborating.
We're collaborating very closely with them. So there's been a couple of major initiatives that we've worked with, especially with the Association of Psychiatrists in Nigeria. And just for a premiere, so people understand what Nigerian Mental Health is. Nigerian Mental Health was established in 2019, and we're a network or a community of mental health practitioners, thought leaders, and over 30 plus organization, mainly based in Nigeria, but also based in abroad, focusing on impacting the mental health space. And one of the things that we did was we need to talk in a collective voice because we're stronger together than we are apart. So we have an open letter that was addressed to the Speaker of the House of Representatives, the Senate President, as well as the President, that's signed by over 30 plus organizations. One of the members who signed that organization was the Association of Psychiatrists in Nigeria. And we delivered it to National Assembly leaders, and look at what happened. The bill has been passed along with other collective efforts from a lot of mental health stakeholders. Now we're working to deliver that letter to the President. And what also excites me about the open letter is that all the leading professional organizations in the mental health space have signed out. We have the Association of Psychiatrists in Nigeria. We have the National Association of Clinical Psychologists. We have the Association of Medical Social Workers, and we have the Association of...
There are numerous social associations. I mean, I was speaking...
Psychiatric nurses.
Yes, I was speaking 2 weeks ago to the National Association of Industrial and Organizational Psychologists.
Yes.
And I'm a fellow, honorary fellow of the Nigerian Psychological Association.
Yes.
So there are numerous such agencies, and actually this country has trained a lot of people. We have psychologists that are working as bankers.
Yes.
Because they are not properly...
The infrastructure is not there for them, and we see the brain drain in the health field in general.
So there's a lot of brain drain, and because other countries that are more alive to this are harvesting our trained psychologists.
And we could, but the thing is that if we made the environment, let's think about it like this, right? Mental health should be something that's mainstream in the community.
Correct.
You know, if you go to your health facility, you can get an HIV test or another type of disease,
but
right?
Are you able to get...
You can't talk to a psychiatrist or a psychologist or anything like that. So, and people are experiencing it because you just talked about COVID, right? We're all having issues. We saw people protesting their lives, their struggles, their mortality that they were facing, their isolation. So imagine if we had the infrastructure where we had mental health practitioner in every single major clinic in all the LGAs.
To tell you how serious this problem is, this problem of total neglect of mental health, near total neglect of mental health in this country. Only recently, I got to discover that the massacre in Owo, Ondo State, where nearly 50 people were killed and by terrorists, and others were injured, and it was a highly traumatizing event. No serious intervention, mental health intervention was given. I only discovered that in the last 1 week. That no serious intervention. And some of us now had to begin to rally around psychiatrists, psychologists, and so on to see what kind of intervention can be done to support the people who have gone through these
challenges.
So that shows you, because otherwise, the state government, that was one of the first things they are supposed to have done to make sure that these people are accompanied for the next few months. This community, the entire our community, and particularly the Catholic community that suffered this, to make sure that they are accompanied. But
we don't. I mean, there's so many challenges, and you just mentioned it. You said the state government is supposed to support. How many state governments have a mental health policy? We have 2 or 3, maybe Lagos and Kiti State, and I believe there's one other one. There's limited state governments that have domesticated and taken mental health seriously. Some states are trying. So for instance, in Abuja, we have the FCT in partnership with one of our mental health partners, Sunshine Series, has something called 112. And if you call 112, it's a hotline that you can have to get services. But it's only restrained to FCT. So even though it's a partnership with one of the federal ministries, so that's something that we need to scale, and something with Nigerian mental health we're working to scale. Lagos has also set up a hotline, right? But how many other states have done it? We haven't seen it. So not only is the domestic laws at the subnational level, but also organizations and states taking on teletherapy and putting more resources into that. We've seen small changes in the body language of some government officials when it comes to mental health. So, for instance, in the beginning of COVID-19, there was no there was a presidential committee set up. No conversation at all
about the mental health.
At all.
And the mental health implication of COVID-19 is enormous.
It's huge. The stigmatization that people were feeling. The frontline workers, all the frontline workers were talking about, you remember one of the big issues was about remuneration, because it's hard work. You have to incentivize it.
And it's very risky work.
Very risky. And so these people would be stigmatized, and people would, have post-traumatic stress disorder and things like that. As they were going back to the communities, people would say, "Oh, you've been working with those COVID-19 people," and they would back up. That hurts our public health development intervention. So if we don't mainstream this conversation, then we're not going to have good social development interventions. And one of the things that happened recently was a flood. So the flood that happened across the country. And so we were glad that one of the conversations we were having within the network was, can we have mental health organizations that can support some of the humanitarian responses? And so some of our organizations were identified. We would link some of our organizations to some of the initiatives that are going on, but we've seen this very limited. Honestly, very recently, we've started some of this conversation.
Whether it is government or corporate organizations in this country, there is this hesitation, and I don't know what it is, criminal hesitation to get involved in mental health. I mean, like I told you, we are involved in training, making sure that we have a large pool of people who have basic knowledge of psychological awareness and psychotrauma awareness and psychotrauma healing skills. But to raise money to do that, it's an uphill that, because people are not interested. In fact, there was a case the day somebody told me, he said, "Look, you have several programs, Father George. Why is it that it is mental? It is mad people you are coming to ask me to support you with?"
It doesn't.
Somebody told me that.
The funny thing is that when it comes to faith, right, and mental health, the connection is so clear. When we think about the top 5 causes, and it's not something I'm making up. There was a study between Epi Africa and the Africa Polling Institute. Of the top 5 reasons why people think about mental health is possession by evil spirits and a curse from God. Why people think those are the causes of mental health. So there's conversations that people need to have when it comes to faith, when it comes to mental health. When people think of mental health, the image that they have based on polling is a person running mad, a person screaming, a person harming themselves, person,
our people are not able to distinguish between being mad.
Yes.
And taking care of
your mental health or your well-being.
And mental that concerns everybody.
Yes.
And to recognize that mental health or mental ill health is a spectrum.
Yes.
No one is perfectly mentally healthy. No one is, whatever, talking about madness. That's the extreme part of the spectrum.
Yes.
But that we all are at one point or the other
of the spectrum.
I
love that you mentioned the spectrum, because I've been having conversations about some of the provisions of the bill. And I think that this is a good thing to clarify the people based on what you just said. So one of the things that the bill does is enshrine human rights for people. So there's no discrimination if you have a mental health condition in legal services and medical services and housing and employment and things like that. It gives you the right to participate in the formulation of your treatment. Yes. It gives you access to agency for information. It protects your dignity. So no one's spreading your confidential information out there. And it prevents things like sexual exploitation. But I was asked by somebody in a conversation, wait, why should those who have mental health conditions participate in their formulation of their treatment plans?
Oh.
Yes, and
they are not supposed to.
They're not supposed to, right? Because they're mad. Why should we be listening to them? And I asked the person this, and I said, have you ever been depressed before? They said yes. I said, should somebody deprive your rights because you've been depressed, right? It's a spectrum. You have ups and downs, but also whether it's PTSD or bipolar, people have episodes, right? And so just because someone is going through a shock or crisis or whatever it is at that time in the spectrum doesn't mean you deprive their rights.
I must say we should be grateful to Aisha Buhari, the wife of the president,
who
came out recently to say, look, after my husband was ousted in a coup, my husband suffered post-traumatic stress disorder. And that he got no help from any organization, from the military or any organization. I, the wife, 19-year-old wife, had to cope with a traumatized former head of state. I thought that was fantastic, because that has highlighted
the issue,
the preponderance of mental health challenges in Nigeria, that even a former head of state suffered it. And he's back as head of state with a history of post-traumatic stress disorder. Meaning that, and that is what you see in my paper, meaning that there are millions of people who are sitting with those challenges. But because this law of 1958 was still what is there, people are not able to come out.
Yes. We need to look. I think that's a great example. First of all, it's humanizing the issue, because the thing about mental health is that people need to understand that they're personally connected with it, right? That they may have a friend who is depressed if they had a traumatic incident, or they have somebody who had some sort of incident like that and they have PTSD. So that normalizing the conversation helps decrease the stigma. But it also another reason why the president should sign this legislation, because he's personally impacted, and he has a personal impact and a personal stake in it. And I think that when individuals, and that's why I'm glad when we see some celebrities, some sports artists and things like that, famous gymnasts, right? When they start talking about Michael Phelps, one of the most decorated Olympians, when they start talking about their mental health,
their story of depression.
Yes, then we understand that anyone can face that, and all we need to give people is the resources. This legislation, the National Mental Health Bill, helps put those resources in the hand. It creates some things that are really important. It establishes institutionally a Department of Mental Health Services in the Federal Ministry of Health. So there's coordinated conversation and there's public mainstreaming in facilities around the country to help with that community-led impact. It creates a mental health assessment committee that has things like faith leaders, social workers, psychiatrists, lawyers, and things like that to protect those human rights of individuals. And I think one of the most important things, it creates a mental health fund. And because we can't talk about supporting mental health without putting the finances next to it.
In that mental health fund, so how are we going to fund this? What are the provisions in terms of how the government hopes to raise money beyond the 6 point whatever percent in the budget of, let's say, 2023.
Yes. Well, we hope that, sometimes we have unfunded mandates, as you know. I used to work in government, and in government we would have something what we call approval without release. So we hope that's why political will is important. One of the reasons why the National Mental Health Bill passed for the first time in history to the presidency is that we had increased political will because of COVID, but we had some representatives that were really instrumental to the conversation. We had the heads of the House and Senate health committees. We had people like Representative Honorable Henry Wamba, Representative Francis Wave, etc., that were there championing. Our hope is that based on whatever happens in elections, some of these stalwart political leaders will continue to push. And then hopefully we have that kind of president, if we have presidential assent, hopefully President Buhari himself, that you just mentioned his story, that he is personally impacted by mental health conditions, will also be a vehicle to make sure that the financing happens. It needs to happen in the budget, right? But it also needs to happen through other agencies. For instance, one of our members has a petition that's currently on our website, which is www.nigerianmentalhealth.org. And what that petition is calling for is increasing of training and funding to the National Primary Healthcare Development Agency, right? So that's one of the agencies that connects to the rural, to the grassroots and things like that. We need to mainstream mental health, not just as a fund, but in all associated agencies.
The work, the organization and all the collaborating agencies, the work you are doing concerning mainstreaming mental health, and particularly making sure that the president assents to this bill, so that people can now make claims because of the law.
Yes.
Now, between 1958 Lunacy Ordinance and 2022, what is it called?
The National Mental Health Bill 2021.
National Mental Health Bill 2021.
Yes.
I mean, it's like
it's huge.
It's huge.
It's huge.
The gap is huge.
Can you believe? But to me, it's incredible that when we talk about Nigeria as a giant, right? We need to talk about Nigeria in terms of human capital development. We can't talk about that without talking about mental health. Mental health decreases life outcomes. They have lower life expectancy.
Definitely.
And the World Health Organization, this is a stat that shocked me, that said one of the biggest predictors of poverty has to do with mental health.
Of course.
So when we have our politicians, we have our elected officials talking about how we need to increase the living standards of our people, this is one way to do it. Globally, $1 trillion is lost in productivity due to mental health concerns like depression, anxiety. So we need to talk about it if we really think that this is important. And the gap is huge. I don't know what to say when we say that we haven't had a mental health bill in the history of our country. In the history of our country. Isn't it shocking to you?
You coming from the U.S.
Well, I'm a Nigerian, but yes, from the U.S. I'm school raised in the U.S. and things like that. And mental health is taken as a big priority for individuals. And people understand it. There you can do things like mental health days, because we need to understand that it's not just about physical health. If I have a mental health challenge, right, or something happened to my child and things like that, I should be able to take a day off, reset, recalibrate, and come back to work. So it's really mainstreaming these things in our conversation and things like that.
Mainstream it in such a way that when people go to, there are people who do annual medical checkup now.
Yes.
That mental health, psychological tests, psychological evaluation,
is also there.
It's also, and we have trained. We have a couple of a number of psychometric experts now in Nigeria who carry out these measurement things, this assessments and so on, so that you go to, let's say, federal medical centers, and you go to general hospitals, you go to teaching hospitals, that it should be possible for you not only to have your blood test and have your x-rays and have your ECG, but also to undergo
a mental health assessment. Yeah, so I think that that's interesting. You're echoing something that the head of the Nigerian Medical Association said. And I was interesting because we're in political season, so we can't separate it.
Oh yeah, he says that those who come up for...
They should have a psychiatric evaluation along with other medical tests, right? Because, a lot of our elected leaders are getting older. We want to understand that they have the wherewithal, the dexterity to say it.
We're not going to elect some demented person,
or anybody has a challenge. Yeah, so I thought it was an interesting proposal. It's subject for debate, but I think the point remains that mainstreaming the conversation and getting it to be one of the important points. And one of the things we're seeing now as a mental health community is that we need to really investigate the manifestos of these elected officials. What do they have to say about mental health condition? Yes. And I would love for the fact that if we have the elections, we all come together. I hope you can be involved. We all come together and we have some sort of town hall or conversation with the new leaders and really put mental health at the top of their agenda.
On that note, we shall be bringing this segment of our discussion to an end. I've been speaking with Dr. Chima Asonye, founder of the Nigerian Mental Health, and you can see he's really passionate about seeing the bill signed into law by President Buhari, the Mental Health 2021 Mental Health Bill, brought to reality, to become a reality. And then our welfare, our well-being will be total, meaning physical and mental.
Yes.
And then we shall add spiritual.
Okay, sir.
Thank you very much for watching. We shall have another segment to discuss further into the integration of mental, physical, and spiritual well-being.
Thank you.
God bless you.